Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Today's topic is contemporary health facts. I would like to give you the opportunity at this time to change channels because some of the information that I'm going to be putting forth to you will be disconcerting as well as disturbing regarding the health at large of Americans. It's not just a story of despair, however, it's a story of despair and hope simultaneously. And by watching, if you decide to do so, you can gain a sense of clarity about the control that you will have over your health, the health of your family, and whether you want to live a long life free of disease and disorder. As we know, Americans spend more on health than any given nation in the world. In 1990, it was in the neighborhood of $350 billion to $800 billion. As per person, it was over $3,500 per person in the United States. Now, they found out that through nutritional deficiencies, an average of anywhere from 300,000 to 800,000 people die per year due to nutritional related disorders that could have been helped, and these would have been atherosclerosis, diabetes, and cancer. This comes from the American Journal of Clinical Nutrition. So out of all of that many people could have been saved through making changes in their nutritional well-being. Irregardless of the fact that we spend the most money on health, the United States ranks 18th in the world as far as infant mortality is concerned. We also rank 19th as far as the degree of longevity of industrialized nations, of how long that we live, irregardless of what resources we have and what's available to us. The World Health Organization in 1991 said that we spent that we spent the most money, but we ranked 37th in healthcare performance, and this was just behind Costa Rica and just ahead of Estonia in regards of total welfare and well-being. Pretty disturbing fact. Americans consume 15 tons of aspirin a day, 18 billion tablets per year. Although aspirin is considered to be harmless, it is the #1 cause of kidney disease. It's the #1 and leading cause of stomach ulcers. It's the #1 cause of toxic headaches. And it is the #1 cause of Reye syndrome in children. So the way in which we're taking medications and the way in which we're leading our lives needs to be examined, which we're going to get with the big profile of today. The first thing that we're going to address is the fact that we're becoming an increasingly fat and obese nation. 1/3 of all adults at this point now are overweight and need to lose weight. 23% of the adults in our country were overweight in 1994, which was less than 10 years ago. 15% were overweight in 1980. We're getting increasingly sedentary, and we're becoming increasingly heavy due to our dietary habits. As a result of this heaviness, we're bringing on a whole myriad of healthcare disorders. And let's break them down. Overweight people spend 36% more on healthcare than people that are not overweight. They spend 77% more on medication than the average normal weight American. 77% more just because we put too much weight on. Your heart has to pump blood 1 extra mile per pound of fat that we have. So we're in Piscataway now. If I'm at 100 pounds overweight, my heart's pumping blood from here to Atlantic City, extra, just because I'm carrying that kind of weight around. Certainly I'm going to be sluggish. Certainly I'm going to be depressed. Certainly I'm not going to have a healthy attitude or self-image or self-esteem. It's very, very important that we bring this weight down. We got to get the weight down. This year, there's twice as much cost associated with medical care of people that are overweight as it would be if they were smoking. Not that smoking's good, mind you, but this whole idea that smoking is bad and smoking is what's causing a lot of things. If you're overweight, it's a more important issue for you to deal with that because there's more problems associated with it. Okay, what we have here is that the World Health Organization says the health costs and condition of an average obese individual as compared to a person of optimal weight could be compared on average to the health of a 50-year-old if you're overweight as opposed to a 30-year-old if you have normal weight. So that's the difference not only in how you would feel, but the difference in the associated health risks common with that age. And there's a tremendous amount of risks associated within that period of time. You've got to lose the weight, and you've got to get the lifestyle and changes and whatever it takes to make that happen. Upcoming, we'll do a weight reduction program. But for right now, I need to drive this into your consciousness. Let's talk about another really, really big problem going on, is that we have blood sugar problems going on in this country at a rate that's unprecedented. We have hypoglycemia, which is low blood sugar. On the other end of the coin, we have high blood sugar, which causes a whole host of health problems. It's known as diabetes, what we call adult onset diabetes or high blood sugar. There's many causes for high blood sugar, but what we're focusing on is adult onset diabetes, diabetes mellitus. The disturbing thing now is that what's happening is that the amount of people and even youngsters now that are getting diabetes mellitus, where it used to be adult onset diabetes, the ages are decreasing downward and downward and downward because our dietary habits are such that we are decreasing, that we're getting the problem sooner. The kids are turning diabetic, where it used to be pushed out longer and longer. Not only that, but we're increasing the amount of diabetics that we have at large. So we're having more people with adult onset diabetes, and we're having the age that it takes to get it decrease. These people have so many as a result of having the blood sugar disorders, and 1/3 of all diabetes goes totally undiagnosed, that we need to be conscious of what's going on with this. Also, a problem is that the hypoglycemic of today is the diabetic of tomorrow, meaning unless you take care, if you have low blood sugar and treat that appropriately, the tendency is that as you get older, you're going to get diabetes because your pancreas is going to be working so hard for all of those years that you're finally going to get diabetes, and it's going to be like a Geiger counter. It's going to flip from one side, boom, to the other, just like that. That's no good. In America, we are now consuming per person well over 200 pounds of refined sugar per year, per person in the United States. There's a corresponding rise in the amount of diabetes to the amount of sugar intake that we're taking as they graph the sugar intake of Americans over the years. Think about it. Decrease the sugar, decrease the risk. These are some interesting contributory causes towards diabetes mellitus, or adult onset diabetes. We say causes or contributory causes because diet alone may not be the total answer, although it really seems to be a big, big factor. And this is interesting as opposed to what most people think. Processed meats, such as hot dogs, bacon, sausage, bologna, and pork, creates a 46% increase in the likelihood when eaten frequently that you're going to become and get diabetes mellitus or adult onset diabetes. That's amazing because that's not something that anybody would correlate or think that would have anything to do with anything. There's a 39% increase in you getting diabetes mellitus with a person that has high amounts of hydrogenated fats in their diet. Now, all of this information is taken from medical journals, medical periodicals, so it's not wild statistics. These are all verifiable things. I want to stick to what we know, and these are what we know. Soda, refined carbohydrates, coffee, vaccines, and even drugs that are supposed to be good for us, such as beta blockers, steroids, and even antibiotics. These medications taken over a long period of time increase your likelihood for developing blood sugar problems. Now, I'm not here to bash medicines or bash drugs. All I'm saying is that Americans consume, 10 years ago, we consumed 50% of all prescription medication in the world. Now we consume 1/3 of all prescription medication in the world. Regretfully, it's not because we're getting healthy and we're decreasing the amount of medication we're taking. It's just that the rest of the world is catching up with taking more medication. The correlation between taking medicine and the amount of longevity that you get in your life and how healthy you are is not a good correlation. In fact, it's the total inverse of that. Most of the people that are living into their 90s and having long qualities of life are people that were born early in the 1900s. As these people die off, I feel that what you'll find is that there'll be a decrease in our age rather than an increase in our age. And that's sad, considering we have all of the resources to change all of these things around immediately, just through a little bit of consciousness and a little bit of lifestyle change. The vast majority of diabetics patients develop heart disease. The vast majority. 80% of diabetics die of heart disease. 80% of diabetics die of heart disease. Let's talk about the heart for a moment. Challenging what was considered to be medical dogma for many, many years, they didn't feel that the heart or heart tissue repaired or these cells reproduced themselves. However, the National Institute of Aging has discovered that damaged hearts can repair themselves by growing brand new muscle cells. Researchers examined 13 hearts after fatal heart attacks and found significant amounts of new cardiac tissue being formed. New cardiac tissue being formed. Compared with normal hearts, the number of multiplying tissue cells was 70 times, not 70%, 70 times greater next to the site of where the damage was at. Just like with Christopher Reeves, these notions that, you know, we have permanent neurological damage, certain things couldn't be stimulated to make better. I now come to realize that the body has the ability to repair itself. Under the optimal circumstances, there is practically no tissue that doesn't have the ability to regenerate itself. And I'm hopeful that in the future, we'll know more about that and we'll be able to do and be better with that. Now, here is something that I really, really, really want you to think about and pay attention to. This was a study that was in the June 1997 issue of the American Journal of Cardiologists. And this was a survey of the cardiologists. 44% of the cardiologists that took the survey said that they took vitamin C, vitamin E, and beta-carotene as antioxidants to protect their heart and protect the longevity of their heart and their well-being. 42% said they routinely took aspirin to help their heart and contribute towards heart health. They went back to the 44% that said that they took vitamins and the vitamin E, the vitamin C, and the beta-carotene to help their health. Out of those, only 37% of those cardiologists ever recommended to their patients that they should take these nutrients to protect their heart health. It's a little spooky, you know, because we look around and we put our faith in doctors and we put our faith in that always the best thing is going to be done for us. And I'm not saying that you undermine your faith and undermine your support of your health team. However, it is your responsibility to get the information appropriately to help yourself and become, for your heart health, one of the 44% of the cardiologists that take these nutrients to make it so that they live and you live a normal, healthier life. Vitamin E alone, taken 400 units of vitamin E per day, decreases the likelihood of a heart attack by 70%. So why isn't everybody taking it as an adult? Beats me. Now, if we're talking about cholesterol for a moment, you know, there's a thing that's got my goat, a thing that's really, really got me upset nowadays, is that when I turn on the TV, if I don't see every other commercial is a commercial for cholesterol-lowering drug, or every other commercial is about Allegra or Singular Air or some type of pharmaceutical drug, I have a couple of problems. Number one is, what is all this federally controlled drugs by prescription by a physician only? What is this even doing on television? Why are you getting commercials on this? Shouldn't your doctor know when to prescribe these things to you? Should you have to go to your doctor and say, I'd like this drug? Just think about it. That's something that's just not right about that. And it increases the use of drugs at large. Basically, the whole thing isn't taking a drug to be healthy. The whole thing is to get away from it. And here we are moving more into it. Think about that. The other thing, too, is that cholesterol is a big issue nowadays. And lowering the cholesterol for most people can be done naturally and through diet and lifestyle and change. A funny thing was I used to try to get my patients, especially my male patients, because they seem to be, you know, their diet is worse than women. So I would try to get them to make changes, take in more water, and take in more grains, and have oatmeal for breakfast. And I'll be damned, I couldn't get him to take oatmeal for breakfast for anything. Now what I tell them is that and it's true, is that the number one thing that increases, that you can eat, that increases male testosterone and male libido or drive is oatmeal. So all of a sudden, I couldn't get them to take the oatmeal to lower the cholesterol, but for the secondary reason, I got people eating oatmeal all over the place. There's a chemical within oatmeal that makes it so that your body doesn't suppress or take apart the production of estrogen. Let's go and get on the oatmeal program, oatmeal for breakfast. Quaker Oatmeal, I just bought a big old container the other day. And do not get the kind that cooks in 20, or you can get the kind that cooks in 20 minutes, but who's got 20 minutes in the morning? Don't get the kind of oatmeal that you just put the water into and mix it around. That's no good. You're going to get the oatmeal that's Quaker oatmeal, cooks in a minute. You just boil up two things of water, put a cup of thing in there, stir it around for a minute, you're good to go. Let's do that oatmeal in the morning. This is very interesting. It's going on in California right now. There's a lawsuit being put against the natural food industry to eliminate red rice yeast from being available at health food stores. Red rice yeast is a naturally occurring yeast compound that, when taken, has a high degree of efficacy in lowering cholesterol without any side effects, without any pronounced side effects. The only known side effect, or the only thing that could be measured with that, is a lowering of coenzyme Q10, which is a naturally occurring energy enzyme, an immune system enzyme. For that reason, the drug industries are trying to get that off of the market. Now, Levacor, Lipitor, Lopid, these common cholesterol-lowering drugs, separate from the myriad of side effects that you can get from taking these drugs, one of the things that happens with each and every one of those is a lowering of your coenzyme Q10 level. So all of a sudden, so what are we talking about here? The drug industry is nervous because something natural could work as something better than taking the prescription drug, which depletes the body in the same manner of that one enzyme which you could take supplementally. So think about it. I was talking to a medical doctor friend of mine the other day who was putting his frustrations on the same along the same lines of what I'm talking about now. He said he was at the Ponderosa Steakhouse, and he went into the Ponderosa and he saw a patient of his, and who has a history of heart disease, who he has on Lipitor. And he walks in, acknowledges that his patient, goes up and talks to him. His patient's having one of these 16-ounce porterhouse steaks. And he says, "Yeah, doc, I'm taking my Lipitor." Now, what's going on there, the message is this, is just because a person's on a prescription drug doesn't mean you still don't need to do the lifestyle changes associated with getting and being better. Unless you make these changes, it ain't going to happen. So, think about these, and think about the medications that I have no problem with. People need medicines, and medicines have a place. But when it comes to like the cholesterol-lowering drugs, which have so many side effects, and some of these other things where it's like, well, we have to monitor anything that they say, we have to monitor your liver because it could cause liver damage. Make sure your liver enzymes aren't up. Well, who the heck is going to take one of these medications for 40 or 60 years of your life and not cause damage? Anything that you're taking for a long period of time is going to cause a significant amount of damage associated with taking that medicine. If a medicine's taken for a short period of time, okay, in, out, done, good, bye. something here. Take this thing, which we know has all these side effects, for an unknown period of time, and it's kooky. You're going to get the side effects. You're not going to get the side effects by taking an aspirin one day for a headache, but if you're taking it every single day, day in and day out, or you're taking anything over the counter anti-inflammatories, if you're doing them on a regular basis, you got to ask, why do I need to do this on a regular basis? Now, 40 years ago, the likelihood of getting cancer in the United States was 1 in 20. The likelihood or odds of getting cancer as of 1990 were 1 in 3. A little disturbing. Now, what's going on is that it's not to say that our lifestyle, I can't tell you the diet and lifestyle are the singular causes of all of these. But I'm telling you damn well that it's very, very likely that you need to evaluate these lifestyle changes to make yourself better and the best that you could be. Getting your blood work done regularly, and do something that you need to be concerned about is that, Matt, here we have norms within your blood work, and you should have your blood work done once a year. Norms within the blood work have changed because as our society has gotten more unhealthy, the norms within the blood work have been expanded. So if the normal range was 0 to 50 10 years ago for a certain enzyme value within your system, now because so many people are high and so many people are sickly in nature, they've lopped that off, and now it's 0 to 55 is normal. So what happens is that when a doctor's reading your blood work, unless it's in that high range or the flag range, the doctor doesn't even pick it up. So he's not picking up the things that contribute towards the lifestyle changes necessary for you to make. The point behind this today was to increase your consciousness for you to recognize that you are in control, and the things that I'm talking about are reasonable, the lifestyle changes. We'll be talking more about the details of exactly what to do, but we're just trying to stir the pot. I'm trying to make it so doing the same old damn thing in the same old damn way is going to no longer give you, I don't want you to get the same old damn result. I want you to make the changes necessary to make yourself well, happy, healthy. And for Natural Healthcare Alternative, I'm Dr. James Golding, and thank you.